I think it was again, like you're doing the e-news every 2 weeks, right?
Yeah.
So the link is for the 12th and the 19th, but
So there's one coming out this Friday.
yeah, yeah, okay, perfect. Okay, so the last couple days, there's a lot of sun behind me. It's a little bit too much glare. The last couple of days has been really nice to see the provincial numbers dropping under 2,000. So 1,600 and then 15, just under kind of 1,600. Um, the numbers on Monday and Tuesday do tend to be a little bit, maybe a little underreported because of fewer tests that are done on Saturday and Sunday, right? And so the Monday and Tuesday numbers usually reflect the tests that are done on Saturday and Sunday. And surprisingly, shockingly, people don't go out to the hospital on the weekends quite as much. Um, but the other thing that was also maybe a little bit heartening today was that the percent positivity was about 5%. So they did about almost 40,000 tests today for 1,500.
Oh, well, that's better.
That's good because
Yeah.
that has been certainly one of the concerns over the last few weeks is that although there are declining numbers, the percentage of positive cases is staying fairly consistent between sort of 8 and 9. And the concern when that number is over 5 is that you might be missing people that do have the disease. Um, that said, the trend overall is continuing downwards, and so I think that that's definitely something to be grateful for. So don't be too surprised if the numbers go up, kind of as the week goes on. Right? It's probably reflecting more just kind of an increased volume of testing over the next couple of days. The overall number of people in hospitals in Ontario did drop a little bit as well by 83. Although the number of and the number of people in ICUs went down as well as the number of people on ventilators, and so that's all really reassuring. It doesn't mean that the battle's done. It doesn't mean that the war is over, but these are really kind of heartening numbers when I see these. Also, the percentage of people vaccinated continues to rise. And so I think the combination of the lockdown and the rising number of people who are vaccinated is definitely paying off in the numbers that we're seeing. So I guess kind of one of the big questions right now is kind of who is eligible to get vaccinated. In Halton, it's all adults. So anybody over the age of 18 is eligible to book a vaccine now. So if you have people in your life that are, teenagers, university students, anybody like that in the Halton region, they are eligible to book at this point. The surrounding regions are a little bit different. So in Peel, they've just announced that anybody over the age of 12 now can be vaccinated. Hamilton is a little behind Halton in terms of the age group that are being vaccinated, but they're catching up. So now in Halton it's over the age of 18, and Peel it's over the age of 12, and that will continue to move downwards. So. I think the hope is to have vaccinations open for 12 to 15-year-olds in Halton by May the 31st. So question that some people might ask is that safe, right? How has this been tested in children and young people, and what is the evidence there? So the vaccine that's been approved for children aged 12 to 15 is the Pfizer vaccine. It's the one that does have trial data for that age group. And so Pfizer did a trial with about 2,300 children aged 12 to 15 in the US. They split them into a placebo group and a group that got the vaccine. And in the vaccinated group, there was actually 100% efficacy at reducing the risk of COVID. So nobody in the vaccinated group got COVID. And there were 18 cases in the placebo group. And so that is reassuring. And also when they did the blood work on 12 to 15-year-olds, they actually mount an even more robust antibody response than 16 to 25-year-olds, which makes sense. Young immune systems are very receptive and they're very strong. And so, there were no significant there were minor sort of adverse reactions afterwards. So the kinds of things that we see in that older age group as well: fever, chills, fatigue, muscle aches, those kinds of things, but nothing severe. It's not a huge trial. It's not as big as the trials that were done on adults at all, but it's a really reassuring kind of start. Pfizer has actually also started enrolling children down to the age of 6 months at this point for a trial with their vaccine.
Wow.
So those trials are starting, and so they're separating that group into cohorts: kids age 5 to 12, 11, kids age 2 to 5, and then kids age 6 months to 2 years. And so that's parents who are volunteering to have their children enrolled in these trials to test the efficacy of the Pfizer vaccine in that age group. We vaccinate kids that young all the time, right? We vaccinate kids actually down to the age of 2 months for the routine vaccines, and we will even give a hepatitis vaccine to a newborn if there's a risk of that baby having hepatitis. So there is a good kind of wealth of data for the safety of vaccines in that age group, but this will be what helps to support, and assesses the safety of this particular vaccine in that age group. So over the next little while, we actually might see that even kids down to the age of 6 months will be vaccinated against COVID-19. Not that they're at risk of getting severe disease, but there seems to be evidence that the vaccine not only prevents severe disease, but may also prevent transmission. And if kids can not get COVID, then they're not going to give it to the people that they love. So that's exciting news, and so we're watching that over the next little bit. The other big question that's kind of on our minds is, and I think I touched on this last week, is what happens if you got the AstraZeneca vaccine? What do you do next? So we still don't exactly have clarity from the province in terms of what the plan is going to be for that population. But there has been a small trial done in the UK, which is called COVCOM, which looks at people who have had a first dose of one vaccine and a second dose of a different one. Okay, so particularly they are looking at the AstraZeneca and the Moderna vaccines in that study. What we know so far, we don't have a lot of data about how robust an immune response there is from that particular study. We do know it makes you feel worse. We do know that the people who get the second vaccine that's different than the first one seem to get sicker in terms of fever and headaches and muscle aches and chills and those kinds of things. And then the immune response data will probably be out in the next little while. There's a signal that people who get both vaccines may be as protected as someone that gets the same vaccine. So we'll see as this data comes out. So that data, I think, will probably support the idea that people who got the AstraZeneca vaccine can safely get one of the mRNA vaccines as their second shot. I don't know what we'll do with the AstraZeneca vaccines if we do get a bunch more of them. That will be a question kind of to be decided at the provincial level, and I'll report back when I know. But those are really, again, sort of just kind of promising movements forward in the fight against COVID-19. So that data is encouraging. And I'm continuing to get lots of calls from my patients who got the AstraZeneca vaccine, asking, what do I do now? Did I do the wrong thing? All of those kinds of things, and having to continue to counsel them that, no, you did the right thing, right? The 2.3 million people in Canada that got the first AstraZeneca vaccine are contributing to these dropping numbers and to fewer people in hospital and to less severe illness, and it's all part of the mix. The deaths from that vaccine are tragic. There's no arguing that, and science is all about, and medicine is all about, sort of safety and risk, and carefully assessing that risk as time goes on. And the real world is always going to be different than than what happens in the lab and in the perfectly controlled conditions, right? And these medications often have to be reevaluated. I mean, I know this from the history of medicine. I think some of you are old enough to remember thalidomide and what medication meant. And so again, that was a studied medication that seemed to be really effective at treating morning sickness in pregnant women. It just had this really tragic, unforeseen, real world outcome. And that is something that happens. And so, we have a front row seat to watching scientific discovery and medical discovery happening, which is not always um, not always what we expect, right? So we're always learning, we're always adapting, we're always changing. So good news, I think, overall. Certainly leading into the long weekend, it's still so important to hold the line and to not gather with family and to not gather with friends and to just keep holding on because we are so close. We are so close, I can taste it. And so um, I'm feeling optimistic for a good summer if we can just continue to do what we're doing. So those are my thoughts this week.
Here's a question for you. How in the world do you keep so well informed? Because you can't build that. It's not as though you say, "Oh, incidentally, here I studied this and watched that and heard that and read this and holy smokes!" I mean, it's got to be very time consuming.
But it's part of every day now. Like I just kind of build it into every day, right? So like, going through the Ontario website, going through the numbers, sort of going through the data. One of the things that's super helpful is the region sends out updates to us every day, right? So we get info points from the region every day. We get there's lots of data coming at us all the time. So over the last kind of 15 months now, I've sort of got a system for how I go through and integrate that information. Yeah,
Well,
but it's
good on you. It's certainly valuable to your patients and to us.
yeah, it's good. These
I
are
have a
every patient I see. There's some kind of COVID related question almost always, right? Yeah. Sorry, go ahead.
Is the dosage different for the younger teenagers? And like we got, I think it was 0.3 of the Pfizer.
Yeah.
Like, do they calibrate it differently?
Probably not. They don't actually in what I have in terms of the data, they don't actually have the volume that they're giving to people.
Yeah.
Look again, but probably not.
Yeah.
Yeah.
That's like a droplet.
For us, yeah.
Yeah,
But powerful.
yeah.
Yeah, for sure it is. Yeah.
Well, what about testing? Unless you have symptoms, you still can't get it tested, I don't think, can you?
Unless you've been, I mean, there are some circumstances where you could, if you were directed by public health, right? So if public health contacted you and said, you may have been exposed, or for that do use the app, if they're notified, they can get that. If people are living in kind of like a congregate living arrangement, or they're sort of caring for a loved one, they can still get COVID testing done. Yeah, but otherwise, it's generally symptomatic people, and still strongly recommending, like, even if you're vaccinated and you have symptoms, you should still go get COVID testing done. It's really easy now, like really easy.
Could that be why the numbers are down? Is because people don't have the symptoms?
It might
So
be.
they're not going to get a test because they don't need one.
Yeah. Again, with increased vaccination, I mean, that is one of the effects of the vaccine is very,
Yeah.
very if symptoms, if any,
Yeah.
right? So,
Makes sense.
yeah.
Mhm.
People can still be contagious if they don't have symptoms, but they're much
Right.
less contagious, right? Than if they're coughing and sneezing and sort of, throwing droplets everywhere, right?
Mhm.
Yeah. And so, yeah, so that may be the drop in the testing as well, for sure.
Yeah.
And the other thing is that there's because of just the time of year, there are fewer kind of non-COVID viruses that are circulating, right? By this time of year, like cold and flu and that sort of thing, for the most part, are sort of declining, right? And so you're not going to have as many people who have like an unexplained fever or have just a cough or a runny nose at this time of year. So yeah, just fewer symptoms in general, even for like non-COVID infections.
Oh, right, yeah.
So what's the percentage of people vaccinated now in Ontario?
It's hovering around 50%. It's 60% in Peel of eligible adults that have been vaccinated. It's just above 50% in Toronto, and I think it's about 50% in Halton at this point as well. Yeah.
Wow.
Super
And they're
exciting.
looking for 75%, right?
They're looking for 75% one shot and 20% fully vaccinated, right? That's sort of the target at this point for kind of opening things up potentially. That would be one of the targets that they're looking at, in addition to drops in cases and ICU numbers dropping significantly. The other thing that the province announced, again, this is going to roll out really differently at every single hospital, is that they really want to try to resume non-emergency surgeries over the next week or so, depending on hospital capacity. So
Wow.
the capacity of the hospitals increases with fewer COVID cases, then that will be starting in the next couple of weeks as well. So yeah, like a tentative, tenuous victory right now, but like good positive signs. Yeah.
Yeah. Oh, oh, okay.
All
I
right.
feel
Good. I have to go. But I'll see you all next week. Okay.
Hey, thanks so
Okay.
much.
Thanks,
again.
Anna. Bye.
Take care.